Welcome everyone to the Primary Care Service Corps Clinician Loan Repayment Program Round 4 webinar. WebEx file archive number 48558.22. I am John Wettergreen from the New York State Department of Health, here with Jeff Fila from the Information Technology Services. I'll be taking you through the key aspects of the program, and Jeff will be covering how to actually apply for the program using the Grants Gateway. If you are a Round 3 awardee, you do not need to apply for Round 4, but you're certainly welcome to stay with us for the WebEx if you wish. Start with the program background. The Primary Care Service Corps program makes funds available to help recruit and retain clinicians who work in medically underserved sites in the state. Funding is provided in exchange for a clinician's commitment to work in an underserved area for a 3-year period, which is we call the Primary Care Service Corps Service Obligation Period. Incidentally, it's specifically at National Health Service Corps active sites. We'll talk more about that later. These are the key dates for the program. Questions are due on by September 17th, 2019. Then we will post the questions, answers, and updates on September 30th, 2019. Application submission start date will be October 1st, 2019, and the application submission deadline is November 4th, 2019 at 4 p.m. After 4 p.m. on that day, the gateway will be closed and you will not be able to submit any more applications. To give you a little more clarity, on October 1st, 2019 at 9 a.m., the status will change from non-gateway opportunity to gateway opportunity. You cannot start your application until October 1st, 2019. And then on November 4th, 2019 at 4 p.m. the gateway closes. Please do not wait till the last minute to apply. Late submissions cannot be accepted because this is a grant opportunity. Talk a little bit more about the key dates. Program-specific questions must be submitted in writing by September 17th, 2019 to the following web address, sch_loan, L-O-A-N, @health.ny.gov, or to the department's address that's listed in the funding opportunity. After September 17, 2019, the department is only able to answer technical questions. For example, how do I find the grant opportunity in the Grants Gateway? And what is the due date for this grant opportunity? All questions and answers will be posted in the Gateway on or about September 30th, 2019. Because this is a competitive grant program, any questions about the program must be recorded and the answers to those questions must be shared with all potential applicants. In order to accomplish that, we're requiring that all questions be submitted in writing to sch_loan@health.ny.gov or by U.S. mail to the address listed in the RFA. Who may apply? Dentists, dental hygienists, nurse practitioners, physician assistants, midwives, clinical psychologists, licensed clinical social workers, licensed marriage and family therapists, and licensed mental health counselors. Applicants must be currently licensed at the time that they apply or be licensed before the award date for this program. Use of funds. 100% of the Primary Care Service Care Award funds must be applied to qualified educational debt. Proof of application of award funds to eligible debt will be required. What is qualified educational debt? Qualified educational debt means any outstanding amounts remaining on student loans that were used by the clinician to pay graduate or undergraduate tuition or related educational expenses, where such loans were made by or guaranteed by the federal or state government or made by a lending or educational institution approved under Title IV of the Federal Higher Education Act. To reiterate, qualified educational debt can be graduate or undergraduate debt. The loan must be in the clinician's name, that is you, the applicant's name. Refinancing is okay as long as it is still an educational loan. So no home equity lines of credit, for example, are allowed. The Higher Education Services Corporation determines whether or not a loan is a qualifying educational loan. Application limits. No more than one application will be accepted from a single clinician. No more than 5 applications from a single National Health Service Corps active site will receive awards. If more than 5 applications from a single site are determined to be eligible, the 5 applicants with the highest scores shall be given awards. In the case of tie scores, awards will be given to applicants with the highest qualified educational debt. I'll make an important point here. We encourage you to start gathering the documentation you will need to apply now. There's no advantage to rushing and submitting an incomplete application. The date of application submission is not a factor in application selection for this program. Award amounts. The funding opportunity will provide the following: up to $60,000 for a 3-year contract to a clinician who agrees to practice at a National Health Service Corps active site for the 3-year Primary Care Service Corps service obligation period. There will be up to $3 million in total state funding, and we expect approximately 35 3-year awards will be given. Awardees with $60,000 or more in qualifying educational debt will receive up to $60,000 for the 3-year contract. Awardees with less than $60,000 in qualifying educational debt will receive an award equal to their qualifying educational debt for the 3-year contract. This slide discusses primary care service care relocators. Primary Care Service Corps relocators will receive 100 additional points when the applications are scored. The goal is to make Primary Care Service Corps an incentive for clinicians currently working in non-shortage areas to relocate to facilities in shortage areas. So, clinicians, to be qualified as this, a clinician must begin employment at the approved National Health Service Corps site on or before May 1st, 2020. And to qualify as a primary care service care relocator, the applicant was not employed at the Primary Care Service Corps worksite before the funding opportunity posting date of September 3rd, 2019, and the applicant was not employed at the worksite with a worksite with a HRSA score of 1 or more before the funding opportunity posting date of September 3rd, 2019. September 2nd, by the way, was a holiday, therefore the posting was actually posted on September 3rd, which is why I emphasize that. This slide discusses National Health Service Corps relocators. National Health Service Corps relocators will receive 100 additional points when applications are scored. The goal is to create an incentive for clinicians who relocated from a job in a non-shortage to an active NHSC site in order to participate in the National Health Service Corps, but who did not receive a National Health Service Corps award due to exhaustion of National Health Service Corps grant funds to apply to the Primary Care Service Corps. To qualify as a National Health Service Corps relocator, the applicant was not employed at the proposed worksite before the National Health Service Corps funding opportunity posting date of December 27th, 2018, and was not employed at a worksite with a HRSA score of 1 or more before the National Health Service Corps funding opportunity posting date of December 27th, 2018, and the application applied for the National Health Service Corps Loan Repayment Program or the National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program in January or February of 2019, and was deemed eligible for the National Health Service Corps Loan Repayment Program or the National Health Service Corps Substance Use Disorder Workforce Loan Repayment Program, and was declined for the National Health Service Corps due to exhaustion of National Health Service Corps grant funds. Grants Gateway. This is the first time this grant is being presented in the Grants Gateway. No paper applications will be accepted. Anyone with potential interest in applying for this program should start the process of applying for a Grants Gateway account at https://grantsmanagement.ny.gov/register-your-organization. Grants Gateway staff are available throughout the process to answer questions about obtaining an account. Jeff Filer will now discuss the Grants Gateway.
Okay, so everybody that applies for a grant in the Grants Gateway must first be registered. That means organizations, or in this case, like you, individuals. So all clinicians that wish to apply for grants in New York State must be registered in the Grants Gateway. And this process actually includes mailing something to us. So it's filling out a form, getting it notarized, and signing it and sending it to us. So information about this registration form can be found on the Grants Management website or in the Grant Opportunity Portal, these two websites down below. And I'll go to both of those as we get into the system in a few minutes. So do realize you're mailing something in, which will take a few days, so you need to give yourself time to get this done. So it's anticipated that all of you, every PCSC applicant, will need to register for the Grants Gateway because you're probably not already registered. Only applicants who have recently contracted for some other reason as an individual with the DOH might have a Grants Gateway contract, and we're guessing that's none of you. I said contract, Grants Gateway account. So one thing you're going to have to do is we'll obtain an SFS ID for you, a statewide financial system vendor ID. So that's part of the registration process. And like I said, once your registration form is mailed in, it may take up to, or will take up to 5 business days for your vendor ID to be created. So don't wait until 3 days before it's due, because it might take us 5 days to get that vendor ID, in which case the due date has passed. So for registration, again, I'll show you the form once we get to logging in. You need to fill out the registration form, have it completed and notarized, and you need to provide us this substitute W-9 form, which will help us obtain a vendor ID for you, and you need to attach your resume or CV. So that's a requirement. We just want to have a resume with it as well. So those 3 things you'll be mailing to us in order to get you registered in the Grants Gateway. So there are user roles associated with the Grants Gateway, and only one of them will allow you to start the application and sign it and submit it. So the first role is the Grantee Delegated Administrator, and this person actually is the first role you'll get. I'm just going to mark it up here. So the Grantee Delegated Administrator, this is someone who can add or edit user accounts and manage pre-qualification, which is not something you're going to be dealing with. So really, this person can only add or create or edit other user accounts. So that's the default role we'll give you, though. So once you submit your registration form, we'll get you set up in the Grants Gateway, or first in the SFS, Statewide Financial System, with a vendor ID. Again, that could take up to 5 days. Then you'll get an email because a Grantee Delegated Administrator account has been created for you in the Grants Gateway. Well, you can't do anything with that as far as the application goes, so the next step will be for you to create this second account called the Grantee Contract Signatory. And this is somebody who can start new applications and submit an application, and you must create and log in with this role in order to submit an application. So again, when we log into the system, I'll show you how to do that in a few minutes. So again, that process is fill out the registration form and have it notarized. Fill out the substitute W-9 form. That allows us to get you an SFS vendor ID. Mail in that registration form, W-9 form, and the resume to the Grants Management Office in Albany. The address and instructions are on page 2 of that registration form. Again, I said it may take up to 5 business days for your SFS vendor ID to be processed. And then you'll receive 2 emails. One email with your user ID, which is your first name, last name, first initial, last name, up to 10 characters, and a number. And then the other email will contain a temporary password. So you log in with that temporary password, the first thing it'll do is make you change your password, and then you're ready to go. So once you log in, this is just the next few steps of that registration process. You log in at grantsgateway.ny.gov with that user ID and temporary password. It'll prompt you to change your password. Then you'll go to Organizations and fill that page out. I'll show you that. And then we'll add a new user account for yourself in the role, like I said before, of Grantee Contract Signatory. And the quick steps for that are Organizations, Organization Members, Add Member, and then New Member. So that'll create a new account for you. You'll get 2 more emails, user ID and password. You log in with those, and you're ready to start your application. So I know it sounds like a lot. You know, filling out the form will take you 5 minutes. You'll have to find a notary. And then actually logging in and doing that will take you, 2 minutes. So it's really not that time consuming to get going. But again, you do have to wait for us to get you registered with SFS, so start early. Once you're logged in as the Grantee Contract Signatory, you'll see an option to view opportunities. And that button will let you, you can click on that button and browse for the primary care service corps grant opportunity, and it'll allow you to click the Apply for Grant Opportunity button. So we'll see that in a few minutes as well. And then there's what's called the Forms menu. You're going to work through the Forms menu. It's a collection of different forms that you're required to fill out as part of your application. That may take you several hours over the course of several days or even weeks. That's fine. As John said, everybody has the same due date, and whenever you get it in, as long as you get it in before the deadline, is fine. And then you'll submit your application. There's an option right next to the Forms menu called Status Change, and from there you'll see an option to submit your application. And again, I'll show you all of that in a few minutes as we go through. All right, so a couple things I want to point out that are part of the application. One of the forms, or a few of the forms in the Forms menu, are related to the work plan. The Grants Gateway has, in this case, a grant-defined work plan, meaning the objectives and tasks cannot be changed or removed. It's just written for you. So it saves you a little work. If you happen to look at that page, which I'll do, you'll see there's nothing you can do on it. Everything will be grayed out. However, there is a summary section. And in that summary, we just want you to write, first of all, the work period, or the work plan period, which is May 1st, 2020 to April 30th, 2023. That's the dates of these contracts. And then the project summary is a required field, and in that we want you to put in the address of the intended work site and then the profession you'll be working in. There's also a field called organizational capacity. While it's a required field, we don't need anything in there from you, so you can just type in NA for that. Okay, so in the budget section, you're going to have to fill out the details of your request, and we really don't need too much information from you. What we need is in the Other Expenses section. So you'll see there's a bunch of different categories, and one of them is called Other Expenses. In the Type Justification, you're going to type Repayment of Educational Loans. And in the Justification field below it, same deal, Repayment of Educational Loans. And then the amount you're requesting for will be up to $60,000, but whatever your loan amount is, or whatever amount that you want covered for those 3 years. So you'll hit Save, and then you'll get back to the Forms menu to be able to work on the other sections. There's also a narrative. So in the budget section, for all the categories, there's a narrative section. So in the narrative section, we want you to say the maximum total that or the amount that you're requesting, and remember the maximum is $60,000 for a full-time clinician. The maximum for a part-time clinician is $30,000. And you need to break down the years based on these percentages. So year one is 26.6% of the total funds requested. So let's say if you were asking for $60,000, it would be 26.6% of that. And I'm going to use that as my example in the gateway. Year two will be 33% of that total funds requested, 33.3 I should say. And year three will be 40% of the total funds requested. So you can see it's not going to be the same amount year after year, and we want you to do the math here to calculate how much you're going to be asking for year 1, 2, and 3. And like it says in the bottom here, all amounts should be rounded to the nearest whole dollar amount. For example, on the next page, we'll show you. And John's going to take over here just to talk a little bit more about it.
Yeah, this table just gives you an example. So for a $60,000 contract, you are going to be asking for $16,000 in year 1, $20,000 in year 2, and $24,000 in year 3. We've done the math here for you to show you what 26.6%, 33.3%, 40% of the number of $60,000 would be. And we've also given you some other round number examples. If you're asking for $55,462 for your grant award, you're going to want to do the math that's indicated. Take 26.6% of that, for example, for year 1, 33.3% of it for year 2, and 40% of that for year 3 on this particular form. Make sure to click Save after all you enter all that information. All right, so I'll pick up now with the review and award process. The department will review applications in the order that they're received in the gateway for completeness. We will notify the applicant by email if the application is complete or incomplete. If the application is deemed complete, no further action is necessary. We'll process it. If a complete application does not guarantee funding. If an application is incomplete, a list of the outstanding items will be provided via email to the applicant. So it's very important that we have your correct email address that you provide in the application. Applicant will have one opportunity to supply this missing information via email to the department within 10 business days from receiving the outstanding item list. Failure to provide missing information will result in disqualification of the application. All correspondence will take place through the sch_loan@health.ny.gov email address. No information will be exchanged through the gateway. The department will not accept late submissions. Funding decisions will be made in the spring of 2020. Contract start dates for all grantees will be May 1st of 2020. We cannot accept phone calls inquiring on the status of an application. On payments and reporting requirements, no advance payments will be made. No payment will be made before a contract is executed. Payments will be made annually at the discretion of the department. The following reports are ongoing and required in order to receive payments. Progress reports to verify continued deployment. Educational loan statements, if applicable, to show monies are being applied, expenditure reports, and year-end and end-of-contract questionnaires. We're going to talk about eligible sites for this program where you can serve your obligation. The healthcare site where the clinician will be employed must be a National Health Service Corps active or National Health Service Corps / Nurse Corps active site on the date of award. Applicants can check if a site is a National Health Service Corps approved site as follows. Go to the website https://connector.hrsa.gov/connector/. Once you're on that website, in the location box, you can enter the name of the town where the site is, or the town that you're interested in finding out about, and then click on the choice that appears on the drop-down box. To see all the sites in New York State, you choose New York, USA. Then you press the Go button. A list of all the National Health Service Corps approved sites and opportunities in New York State, centered on the requested town, will appear. Click on the Sites tab. It's like a gray trapezoid with a number in parentheses. Scroll down the list to find the sites ordered by proximity to the indicated town. HRSA Health Workforce Connector shows the HPSA designation scores for the site. And you'll see them there. There's primary care, dental, and mental health scores. As an applicant, you can actually calculate your own application score by yourself by looking at Attachment 7, the application scoring methodology of the funding opportunity that's posted. It's the last pages of that. And using the HRSA designation score that you found in the previous bullet, and the other factors that you know about your job. For example, your profession, your employment time status, that is whether you're full-time or part-time, whether you're applying for relocation status as a primary care health service corps relocator or national health service corps relocator, and the substance abuse disorder information for yourself and for the site that you are applying for. Default provisions. There are severe financial consequences if the clinician fails to complete his or her primary care service corps service obligation. Repayment for default is the greater of either $31,000 or the sum of the proportionate amount of the loan repayments paid by the state of New York to the clinician representing any period of obligated service not completed, and $7,500 multiplied by the number of months of obligated service not completed, and interest on the above amount calculated from the date of default at the maximum legal prevailing rate as determined by the Treasurer of the United States from the date of the breach. We'll give an example. We have a default by a clinician on a 3-year full-time $60,000 contract after 27 months of service would require payment to the New York State for $82,500. Calculations are shown there. This $82,500 loan repayment debt will begin accruing interest, which is currently 7.5% APR, as of the date of default. Contract modifications. The decision to permit either of the following is at the sole discretion of the Department of Health: to change the service location for a clinician or defer service obligation for a clinician. The department must be contacted prior to any action being taken to change service location or service obligation. For site changes, in evaluating the change of location request, the department will consider whether the clinician would have been selected as a primary care service corps awardee if their original application had been for the proposed new location. Accordingly, changes in location to sites with HRSA scores equal to or greater than that of the original site would be very likely to be approved, while changes to sites with lower HRSA scores would be much less likely to be approved. Tax issues. Funds to support loan repayment may be currently exempt from federal and state taxes. You should not be issued a 1099 statement, although sometimes that seems to happen accidentally. Please consult your tax professional for more information about your specific tax situation. I should mention that since I don't work for the IRS or the New York State Tax Office, I cannot comment or opine on your specific tax liability. Other scholarships and loan forgiveness. No other state or federal loan forgiveness obligation can overlap or coincide with the 3-year primary care service corps service obligation. The only exception to this is the federal public service forgiveness program. You can be participating in the public service forgiveness program and the primary care service corps simultaneously, but no other program is allowed to be simultaneous with the primary care service corps. This is the list of the attachments and uploads that are required for application. There is an employment letter template, which is mandatory. It is signed by the employer at your intended work site or work sites, and they have to pick the relevant sentences and passages from the template. There's a consented disclosure form, which allows the Department of Health to check your qualifying loan balance with the Higher Education Services Corps, which you must sign and date. You must submit current loan statements for your qualifying educational loans. Current professional licenses, you'll need a photocopy of your current professional licenses as an attachment. And then the optional attachments are for the substance use disorder certification, proof of prior relocation to a National Health Service Corps site, and then as I mentioned earlier, there's the application scoring methodology, which is in the final pages of the funding opportunity document itself. And there are reference materials for the Grants Gateway. The vendor user guide is available at https://grantsmanagement.ny.gov/vendor-user-manual. I mentioned this earlier. This is a greater detail on attachment 1, the employment letter. You need to use the template for attachment 1 as provided. All appropriate data elements should be included in the letter, including the clinician name, name of the address of the work site, the percent of time at the site, etc. Employer must insert the appropriate classification statement for those listed in the template, but may not alter any other text in the statement. Cutting and pasting the relevant text from the template is recommended to ensure that the correct language appears in the letter. Regarding the loan statements attachment, loan statements must be dated within 30 days of the application submission date. The loan statements must show, at a minimum, the following information: evidence of statement authenticity, such as letterhead or statement banner with the credit corporation logo, the creditor name, the applicant name, the loan number, the loan statement date, and the loan balance. Based on applications submitted for previous rounds, most applicants simply go to their creditor's online website and print out their loan statements. This is acceptable, just so long as we can see that there is, for example, the creditor banner that identifies the creditor authenticity. Attachment 2 is the consent to disclosure. Loan statements will be forwarded by the New York State Higher Education Services Corporation to verify the existence and amount of qualified educational debt. Applicants must complete attachment 2 to give consent for HESC to disclose any loan information to the Department of Health. No primary care service corps award shall be made in excess of the outstanding amount of the educational debt as verified by HESC. Awardees will be required to submit educational loan statements on an annual basis to ensure payments are being applied to the loans. On questions, the webinar link will be accessible on the department's website shortly after this live event, probably in a week or so. All questions must be submitted in writing to sch_loan@health.ny.gov or to the department's address listed in the RFA, and they are due by September 17th, 2019. After September 17, 2019, the department can only answer questions of a technical nature. All questions and answers will be posted to the Grants Gateway on or about September 30th, 2019. I'm going to hand it back to Jeff Fila now.
So I went to grantsmanagement.ny.gov. That's the website for my team, the people that manage the Grants Gateway. And we go into a few different places you can find it, but if you go to Get Started and Register Your Organization, as the name implies, that's some information on how to get registered. So, of course, you're not an organization, you're an individual, but it's the same process. And if you go through, there's an overview and some details here, and the actual form can be found in several places on this website. Right here is that registration form for administrators. Here's also the substitute W-9 form, which I mentioned you need to fill out to obtain for us to obtain for you an SFS Vendor ID. It asks for organizational chart. As an individual, you don't need to provide that. What we do want you to provide is your resume or CV. So let's take a look at this registration form. I can click on it here. And it'll download and open up a PDF. You can see it's a 2-pager. Page 1 is the form you need to fill out, and page 2 is the instructions. The instructions include on the very bottom here, of course, that it has to be signed and stamped by a notary public, and then the address at which you need to send this. So that's right here, 99 Washington Avenue. So we don't accept scans and emails of this. It does have to be mailed via the regular carrier mail. Back to page 1, you can see it's just the form to fill out with your name. You don't have a business name, your federal ID. This would be where you put in your social security number. So we do need that to obtain a SFS Vendor ID for you. Just so you know about the security of this, yes, you're filling it out and sending it to us. Once it's used, we black it out and we only use your last 4 digits in the grants gateway to identify you. The SFS needs that number though, because they can't set up a vendor ID for you without your social security number. So if you don't have a vendor ID, you can't get paid. So of course that's a very important step. You can see your address, check the type of organization. Of course, you're not an organization, you're an individual. Delegated administrators, it says plural, but it's only going to be yourself. So just type in fill out your name, title, phone number, and email here in the first one. Don't worry about entering the second one here. Authorization, head of organization, that's you as well. So fill this out, the same information here. And then down here is where the notary public needs to sign it and date it and stamp it down here in the bottom and sign it. So pretty easy to fill that out. Then put it together with that substitute W-9 form, which I'll show you in a minute, and like I said, a resume or CV. So if we go back to the grants management website, back to, again, if we went to the top just to show you, to get started, register your organization, and you jump down to the forms again. Here's that substitute W-9 form. If I click on that, this is a document basically used to, again, obtain your SFS Vendor ID. Fill it out. Here is the TIN is actually obviously your Social Security number. All right, so you fill both of these forms out and send them to us. Let me go back to the grants management website just to show you. Not only that, but you can obtain a copy of some other documents as well if you go to training and guidance for grant applicants. And we go down to documents here. You can see there's a vendor user manual as well. So if I scroll all the way to the bottom, vendor user manual. Okay? You might notice this pre-qualification. A lot of information about pre-qualification in this. That does not apply to you, so don't worry about it. Pre-qualification is something that not-for-profits must do, but not individuals. So don't worry about that. And be happy because that's a time-consuming process as well. Just to mention, back on this training and guidance for grant applicants, there's also links to other webinars, although I don't think you need it because you'd probably refer to the recording of this webinar we're talking about. The documents I just went to, and then several instructional videos. There's actually a video about how to register and a few other things there as well. But I think everything you'll need will be in this video we're doing right now and recording, and we'll be posting. All right, so that's the Grants Management website. Now let's go into the Grants Gateway. So that is at grantsgateway.ny.gov, and once you fill that out, it'll just fill out the rest of this address. So grantsgateway.ny.gov is all you have to do, and you'll see before you log in, you're presented with what's called the Grant Opportunity Portal. So in here, you can browse and search for grant opportunities. You can sign up with this notification tab to be alerted of new grant opportunities. So for instance, if you want to be alerted to this one when it's posted, you'll fill out your first name, last name, organization, you can just type self, email, and then you can select what you want. And I believe this one is under Health Services, or you could just select all, or even all Health and Human Services. And the next time a grant opportunity is posted that has one of these categories, that falls into one of these categories, it'll send you an email with an alert. So if I go back to the portal, that's the notification section. And the registration form we talked about, and I showed you, is also found here from the portal. So you can go here to this request access. You won't already have an SFS vendor ID, so there's no point in typing anything there. But here again is that substitute W-9 form. Here again is our registration form that I talked about. And it says follow the instructions on the registration form. So 2 ways to get to that registration form. One at the Grants Management website, grantsmanagement.ny.gov. The other at the Grants Gateway portal when you go to grantsgateway.ny.gov and go down here to the registration form. Okay? Once you register, you will receive, again, you register by sending it in via mail. We'll obtain an SFS vendor ID for you. And then after that happens, we'll sign you up with a user ID in the Grants Gateway. When that happens, you'll receive 2 emails. like the ones I'm going to show you in my inbox. One is, they both say New York State Grants Gateway. Ignore that this is from NYGG Test. Yours will say it's from Grants Gateway. But the first one is your user ID. In my case, it's mkeegan1. And the second one will be your temporary password. So notice, I point this out because sometimes people will inadvertently copy. You can see there's a blank space after that last 0. If I was to copy that and paste that in as my password, it would be identified as incorrect because, of course, there isn't a blank space in my password. So just make sure that you're selecting only the password that's provided to you. So I'm going to copy and paste that, and I'm going to log into the gateway and register or log in as my user and then create a new user ID. All right, so actually, this is what's called, this is our live site. I'm going to go to a test site that we have, and I'll log in from here. So I've gone to the website, and I can click on Grants Gateway Login, and it asks for your user ID, which of course is from that email. Mine was mkeegan1, and the password, I'm just going to paste it in there and hit Login. So the first thing it does is says you have to change your password the first time you log into the system. And if we scroll to the bottom, at least the bottom of this form, we can see the password and confirm password fields. So I'll fill those up. And I'll hit Save. And you'll see a green go sign or green light that says your user information has been saved. Okay? So if I went to the home page, it tells me that I'm a Grantee Delegated Administrator. Now, a Grantee Delegated Administrator, if you remember from the webinar, cannot apply for a grant. So we need to create a new account for ourselves. And that's back on Organizations. So you can see in the black bar here, we have Organizations. And in fact, the first thing you really need to do is fill out this page. And the reason you do that, you can see you've got the red arrow. We're not going to be able to add more members until we do this. So you can see only the fields with a red asterisk are required. So we'll put in my phone number. We'll put in, what else is required? So you must choose a state agency, which state agency you do contract with or would like to contract with. Of course, in our case, we'll pick Department of Health. And as an individual, I believe that's all we need to do. We'll hit Save. And you can see it gives me the green light again. This information has been saved. Now we can go and add that second account for ourselves under Organization Members. So we click on Organization Members. And you might remember this path from that slide in the webinar, in the PowerPoint. Organization Members, Add Members, and then New Member. So you're not searching for somebody. You're adding a new member. And we'll fill it out here again. And I'll just type dentist, let's say, and my email. And date active, just leave as today's date, but you need to select the role, and in this case, we'll do Grantee Contract Signatory. So you're not getting a contract yet, but that's the role of someone who can remember, start an application, save all the information, all the application information, and then submit it by signing it at the end. And it requires a password, it requires a phone number. If it wasn't filled out already, you'll have to fill it out there. Mine was already. So we'll hit Save and Add to Organization. And now I've created a second person with that role of Grantee Contract Signatory. In a matter of seconds, I'll get 2 more emails, one with the login information and the other with the password. So I'll log out, go back to the login page. I know it's going to be mkeegan2. I imagine it will be. And we'll see what the password is that just arrived. So, yep, mkeegan2. And there's my temporary password. Again, I'm making sure to not copy anything that's besides the letters and numbers. And I go back to the gateway, log in with that, and change my password, and I'll be ready to go. So I know that seems annoying and kind of an extra step that you really shouldn't need to do, but you do need to do it. So that's the way it works with the gateway. And now if I go home, you can see I'm logged in as someone in the role of Grantee Contract Signatory, and I can see something I couldn't see before, which is this, View Available Opportunities. So now I can click on View Opportunities and apply for it. Now, before I do, I'm going to go back one step, and we're going to talk about how to find the grant opportunity in the portal, and then here once we're logged in. So I'll log out. So the grant opportunity portal is there for anybody in the world to access and view what grant opportunities are available in New York State. You don't have to be logged in. You don't have to have an account to do it. But if I click on Browse, or in my case, Search, I can search for a keyword or several keywords to find this grant opportunity. So if I type in Service Corps and hit Search, now you can narrow it down if you wanted to, but I know this is a unique 2 words that I'm going to find this one, but you could search by agency and so on. If I hit Search, I actually find 2 results. Why are there 2 results? One is because one is the announcement that we made on September 3rd, and the other is the actual grant opportunity that I posted today in our test website. So when you do it in the real website, in the real Grants Gateway, this second one won't be available yet. I'm sorry, this first one won't be available yet because it won't be posted until we do it in, what was the date again? October 1st.
When they start applying, yes.
Yep, at 9 o'clock. So let's click on the bottom one here. You can see this says non-gateway. John referenced that in his remarks earlier. So this is just the announcement explaining to us what's available. We do have, if we scroll to the bottom, this View Grant Opportunity, which gives us a link to the RFP. So I'm going to look at that in a minute. And some other information, you can see applications are due on November 4th at 4 p.m. and some other information that we'll get to when I view the real opportunity. So if I click on this, I think it's going to give me an error, but that's okay. In fact, I'm going to do it this way instead. The only reason it's because I'm in my test website. All right, so if I go here, and let's say you did click on that button, View Grant Opportunity, it would bring you here to allow you to open the PDF of the grant opportunity, the funding opportunity RFA. So Request for Applications RFA. Now, I'm not going to go through all the pages here. You can see it's 32 pages of information. Right now it says for informational purposes only, because this is subject to change. On October 1st, the real one will be posted, but this will give you most of the information that you need to get started and prepare yourself before that date. Again, you don't have to be the first person to start it on October 1st. That's not going to help you or benefit you, but you do have to have everything done and submitted prior to November 4th at 4 p.m. So if we were to scroll through here, we can see the table of contents, introduction, who can apply. A lot of this information was already in the PowerPoint that you saw. Certainly, you should go through here and look at it and understand it. Administrative requirements, application information. So starting in section 5 on page 20 is how to fill out the application. And here are those details. So I do want to skip down to completing the application. It gives you a link to that manual that I spoke about before, the vendor user manual. It does mention that you really need to use Internet Explorer 11 or higher. Now, this says it causes errors in the work plan section, which thankfully for you, you don't really have to worry about that page that has the errors. So it will probably be fine to use Chrome, Firefox, or Safari, or Edge. We do technically only support Internet Explorer 11, but I'm pretty sure the others will work fine since you're not going to the work plan. Just realize this is, a limitation that we have with the system that we are working on, but until it's updated, you have to use Internet Explorer 11 if you were going to go into the work plan details section. Okay, now I wanted to point out a couple things here. First, it talks about the attachments. These are the attachments that you'll see or will see when we get into the gateway. These different attachments where we download them. And then attachment 7 is here in the RFA. It's the scoring methodology. But it does give you all the questions that you're going to need to answer. So this is one of the big time-consuming parts of filling out your application is these 55 or 50 or so questions that you'll have to go through. Well, here they are right here. So if you want to get a head start, you can fill out, let's say, a Word document with all of this information and have it ready to go so you can copy and paste your answers when it comes time to apply. All right, so these are all the questions you'll be asked and information about them. And then the work plan, like I talked about, tells you what to put into the project summary, but it also tells you that you don't have to worry about what to put into the work plan details form, which I'll show you. Same deal with the budget. Remember, we talked about that in the PowerPoint, and it tells you what to fill out. You're going to put in repayment of educational loans as the type and justification, and you're going to type in the amount, which is, of course, not to exceed $60,000. And then we'll look at that narrative section as well that we talked about a few minutes ago. All right, so we're armed with this information. We've gone and filled out, let's say, a Word doc with our answers. It's probably a good time to start our application now. So I'm going to go back to the gateway, and I'm going to log in. So again, I was... Okay, so I logged in as a Grantee Contract Signatory. And we have this View Available Opportunities. So remember before we went to the Grant Opportunity portal to find out about it. Well, that's not where you go to start your application. You go here to View Opportunities, and you can again search for it or scroll if you'd like to. Now, this actually is pretty easy because we are an individual, and there's only 2 grant opportunities out there that are allowed for individuals. If you were a nonprofit, there'd be, a list of many more grant opportunities. So, in fact, you really don't even have to search for it since it's already on the list. But if you did need to search for it, you need to search for one of these or some of these keywords that are in the name. So again, if I search for the words Service Corps, I can see that one obviously is available. And we'll click on it, and we see the same information that I saw in the portal. However, the difference being this: apply for grant opportunity. This is where we can start our application. Before I do that, I wanted to point out, remember John said that the questions and answers will be posted here to the gateway. Well, right here is where they'll be posted. It says they'll be uploaded, and the link will be right here in this section where I'm moving my mouse in questions and answers link or upload. Now, they may also include it in the RFA, a link to it, or they may include it at the health website, but the easiest way is to come here to the Grants Gateway, search for Service Corps, and find it right here. So that's in the portal or once we're logged in. All right, so I want to start my application. I'll click on Apply for Grant Opportunity. And I'm now in my application. I'm the first person to apply, so my application number is DOH01 PCSC4-2020, and my number is 00001. I'm the first application. Okay? So, first page is the application main page, just an overall summary. I haven't given it a title yet. I haven't requested any funds yet, so obviously those are blank. But let's go and do that, and that's done here under the Forms menu. So remember I mentioned the Forms menu before. Let's talk about the other fields first. So up in the top here, it's basically like a search bar. So you can search the portal, you can search for any applications or contracts or payments you may have in the system. I'm guessing you'll have none. You would have no progress reports, which are related to contracts, and you would have no tasks, which are related to contracts. So the only thing useful to you here is once you start your application, you can always come back to applications and search for it again. But you don't even need to do that, and I'll show you in a minute why you don't need to. Then we have in the black bar here kind of reference or administration, so some training materials, information about your organization. Remember, we went here, organization, and then members to create that new account. Profile is your profile where you filled out your password, and et cetera, and log out would obviously log you out. The blue bar, I call this the action bar because based on what page you're on, there's certain actions you can perform on it, usually the save button. So the save button will appear here as we go to pages that we can fill out data and save. All right, we've got these green buttons here. The Forms menu we'll be doing most of our work in. And the other button you'll care about is status change. You'll see I have an option to submit my application as we go forward. You can ignore management tools, ignore the progress reports. You're only going to be working in Forms menu and status changes. All right, so let's go to the Forms menu. You'll notice I can hover on it and it pops up the menu. It's a lot easier just to click on it and view the entire Forms menu. So it's separated into several sections. First with the contract documents. So this isn't anything you need to worry about as far as the application goes. If we click on this, it shows us the different parts that make up a contract. If we were to be awarded a contract, this is what a link to the sample master contract is. It's the master contract agreement that the state of New York has. We also have an A1, program-specific terms and conditions, and we have an A2, federal-specific terms and conditions. And you can see I can view those files if I wanted to, just to see kind of what you're getting yourselves into if you were to get a contract. So the other thing is this attachment M. It's related to MWBE, which is something that's required in the state of New York, the Minority and Women Business Entity. So you should be familiar with that, and you can click on View File to see that. I'm not going to do those now, just for the sake of time, but you might want to look at them. But again, they're only related to if you were to obtain or receive a contract. All right, so the next section here is not something we need just yet. Print application, well, there's nothing to print out yet. Full version of RFP, so we've already seen that, but if you want to see it again, you could click on it there. And application versions, that'll become filled out, or there'll be a version there once we submit our application. So you need to fill out these sections: program information, expenditure budget, work plan, and the uploads. Okay, so let's take a look at project site addresses here. So this is not part of a contract if it ever became a contract. Basically, we want you to fill out your proposed work site. If you don't have too much information, I think you probably should, you can also just fill out your name and address. I think that doesn't really matter there. So, and I'll just put in 123 Main Street, Albany County, and 12345 we'll call it. Now notice regional council and agency specific region. Both of them have the option for NA. They're not required, so you can just leave them blank. All right, so I filled out a form, and I'm going to hit Save. And it gives me the green light that I've saved the information. Now, if I didn't do something that was required on the page, like I forgot to fill out the name or description, and I hit Save, I'll get an error. Red light, a red hand that says project name description is a required field. So the system will let you save this page. I could leave and pick it back up tomorrow, but it will never let me submit this application unless all these required fields are filled out. So we'll fill it out, hit Save, and we'll go back to the Forms menu and the next section. All right, so the next section is here, program-specific questions. We'll click on that, and that's those 50 questions that I showed you earlier in the RFA, I should say. All right, so what is your project title? So the RFA tells you the name of it is the Primary Care Service Corps Loan Repayment Program. I just have a little cheat sheet here. So that's what you're going to put in for the name. Just copy it from page 1 of the RFA. And now your first name. If anybody knows who Maynard James Keenan is. Your SFS Vendor ID. So you've obtained that number. So it would have been sent to you. You'll get an email for that. And it usually starts with 1, I think it's 11. It might be 12 by now. 0000, and let's just say 555. I don't know how many characters it is, but I think it's 9 characters. Are you a citizen of the United States? So I'm not going to read every question and answer it appropriately. I'm going to just show you how to do it. So you can see some of them are required fields. For instance, number 6 is a yes or no. You have to answer it because of the red asterisk. Number 7, if you're not currently licensed, on what date did you apply for the license? You can see it's a date picker, and you can select the date. So I'm going to skip that because that's not required for me. Have you been excluded from or terminated by the federal Medicare or Medicaid programs? Disciplined? Are you under indictment? So these are just yes or no questions. Are you in breach of any contract? So you will have read all those questions and be ready to answer them. I'm just going to answer no to all these. So current amount of eligible student loan debt, round to the nearest whole dollar. I'm just going to make it easy and put in $60,000. So employer, I'm just going to do this for some of these. site name and address, number of weekly work hours. Now this is a number field, I'm guessing, so if I type in letters, see it gives me an error. So you do have to put in numbers here. All right, so I'm just going to put in more information in these fields. This would be a work site 2. I know I did 40 and 15, but whatever. And there's a work site 3 if you need to. You can see that's not required. So profession, I'm just going to say dentist. Specialty, subspecialty, you can answer if you want to. You can see not a required field. Requested contract employment status, full or part. All right. I'm just going to start filling these out. I think you get the point. You got to be prepared for these. Direct primary patient care and ambulatory setting, number of weekly work hours.
Just put 10, I think. Just put 10 already.
All right, 10. All right. So I'm skipping some of these that are not required. Work site on December 26, 2018. Same information. All right, so prefix, maiden name, home address, city, state, zip, email. It doesn't check that it's a @ answer, so you make sure that it is. When I say @ I mean the @ symbol there. Phone number. All right. Okay, and at the end, there's a couple questions that are not included in the RFA. Basically, making sure you know what you're doing here and you're following some of the best practices. So submitting early, understand that it's strongly encouraged to submit your application early. We're not saying because the earlier applications get graded higher. We're saying that because too many people wait till the last minute and then realize, they forgot to answer this question here. And they try to submit it at 3:59 and they get an error. And by the time they fix it and take care of it, it's too late. So we want to be sure that you give yourself enough time to get it submitted. And I'm going to, in fact, forget to fill out my email address just to show you how that happens. Understand that the applications are due on the due date and time on the cover of the RFA, and that's it. There's no exceptions for late applications. Understand you have to be in the role of Grantee Contract Signatory to submit it. So we already did that, so that's good. And like I said, no late applications are accepted. The due date at 4 o'clock on November 4th, that's it. So don't try to hit the button at 4:01 because it'll be gone and it won't allow you to. So if it was me, I'd be doing it on, let's say, November 1st. All right, so I'm going to hit save, and I'm going to get that error because remember I deleted or forgot to fill out my email address. So it says, wait a minute, question number 46 requires a response. Well, I'm going to ignore that for now because we'll try to submit it later with that not filled out, and of course you'll see that it won't let me. Now, let's say it's the end of the day and you want to log out and come back tomorrow. That's fine. You could log out, log back in, and when you get to the home page, since you started the application, it's here under My Tasks. So you can go down to My Tasks, Open Tasks, and click on that application number 00001, in my case, the one that I started, and get back into it. You could also go back to Applications, and you could actually leave it all blank because, of course, we've only started one application in the whole gateway, and we hit Search, and there's that same one. I can click on it, and I'm back to the main page. So let's go back to the Forms menu, and you'll notice I've got an error here because, of course, I forgot that one question, but we'll ignore that for now. All right, let's go on to the budget. So there's 3 sections you need to fill out, or actually 2 sections you need to fill out. This you'll just look at. Other expenses detail. So remember the requirements or what's allowed, for the different years. Well, we're going to group that all into one. And remember, the instructions give us repayment of educational loans as the title. So other expenses justification, or description, I should say. And then justification, same thing. And how much are you asking for? You can't put in $70,000 here the max is $60,000, and we'll hit save. Now, it will let you put in $70,000 or even $60,001, but you need to put in at max $60,000. All right? So we're putting in how much we're asking for. That's pretty easy. And if we go back to the Forms menu, now I could hover and go to the Narrative section, but I'm not going to. I'm going to click on Forms menu again and go down to the Narrative section. The Other narrative, meaning it's the narrative for this section called Other. And you'll remember from the RFA, it tells us what to put there, the percentages or the amounts for each year. So I'm just going to put in all of these. So let's say total request is $60,000, and then year 1, $16,000, year 2, $20,000, and year 3, $24,000. So that's all we need in the narrative, and that's explained to you in the RFA instructions, and we'll hit save. Now, notice if we go back to the Forms menu, well, there's nothing to point that out, but Other narrative is not a required field by the gateway. Budget certainly is, but the narrative isn't. So it would let you not fill that out, but we really do need you to fill that out. So make sure you do that. And if we go down to Expenditure Summary, this is just showing you what you've applied for, what you've put in for. So all these different categories are hidden from us because all we care about is the category called Other, and we filled out $60,000 there. So it's saying the subtotal is $60,000, and the total, of course, is also $60,000. There's no match funds requirement here, so that's all blank. All right, so expenditure summary was just an FYI type of page. You do have to look at it, though, just to kind of make sure everything is filled out right. All right, next is the work plan overview form. And the work plan has 2 sections. This overview form is the first section. And we have the dates, which I forget. They were May 1st to April 30th. All right. So we have 5/1/2020 to 4/30/2023. Yep. Project summary. Provide a high-level overview of the project, including the overall goal and desired outcomes. That's not what you're doing. If you remember back in the RFA, it asks you to fill out the address of the intended work site and your profession. So I'm just going to fill that out. Obviously, you'll type the real information in there. And then organizational capacity, we don't need that, so just type in NA. All right, so pretty easy to fill this one out. The dates, which we give you, the project summary is just your address where you're going to be working and your profession, and then NA here in organizational capacity, and of course hit save. Now, I want to mention something that I probably should have on the program-specific questions page, and that is the system has a timeout. If you were sitting here on this page and filling things out, and maybe you got a phone call or you got interrupted somehow, and you didn't do anything for 20 minutes, the system would log you out. So if you hadn't saved that page in a while, anything that you didn't save would be lost. So make sure that you're hitting the save button. I'd say every 10 or 15 minutes at max. It'll time you out at 20 minutes. Now, if you had copy and pasted from a Word document, let's say you put all your answers in a Word document, it probably will take you less than 20 minutes just to copy and paste everything. So just be aware, make sure you save every 10, 15 minutes. Every time we save a page or move to a new page, it resets that clock. So we just did the work plan overview form. Let's go to the work plan properties, which you don't have to fill out. Remember, this is just for your viewing only. You can see everything's grayed out. So this is something you don't have to worry about. Just realize it's here. This is what the work plan would look like on your contract if you were to be awarded a contract. Okay, so I'm going to go back to the Forms menu. And the last section is those uploads that we talked about. So it's called the pre-submission uploads. And you can see there's 6 documents here. So the employment letter template. And John explained this. We click on this. It'll download a Word doc for us. And they said you can copy and paste from this into another document. So it just gives you this template of how to fill out a employment letter, what your employer should be filling out. So you're going to fill out things, for instance, the clinician name, the name of the employer, clinician name again. of your time. So you can see all these things in parentheses or in brackets you need to fill out with your particular information. He, she, etc. The applicant worked, did not work at the affirmation sites, and so on. So use this as your template. And notice that it talks about these other pages. It has statements here. So full-time, physician assistant, etc. That's the wording for that section. For a certified nurse midwife, there's this section of wording, and so on. Am I explaining this right?
You are.
Okay. So you're not providing all of this information. You're filling what applies to you. You're providing what applies to you. Page 1 here, and then the details here. Okay, so use this as your template to provide this document. Once it's filled out, back in the gateway, you're going to browse and then attach your finished document. So we would prefer that it's a PDF. In this case, it could be a Word doc if you want, but we prefer it to be a PDF. In fact, most of these, or all of these, we prefer to be PDFs. So I clicked on it, I found it on my computer, and I'll hit Save. Now it's going to give me some errors here because I didn't do attachment 2, 3, or 4 yet. Anything with a red asterisk is required. So it would never let me submit my application until these are taken care of. So consent to disclosure, another form. If I click on it, this is a PDF. Disclosure form, you read it, sign it. Now what do? You read it and sign it. You need to print it, sign it, and scan it. Scan it as a PDF and then attach it here. So I'll click on Browse and attach it. I'm not going to hit Save just yet.
And the same, by the way, is true for the employment letter. You'd need to print it. It needs to be signed and dated, scanned, and put back in. We need to see the signature copy.
Right. Loan statements. So as John said, you could get them from your website. You may have a PDF you can download. PDF would be better because then you don't have to convert it. If you took a screenshot, you do have to save it as a PDF as well. So I'd go to my website, I'd get it, and attach it here by clicking the Browse button. Your current professional licenses. There is a template here. It's just a placeholder. Applicants are instructed to upload a photocopy or printout of any professional licenses currently held. Now, one thing I want to point out here is that the gateway only allows for one attachment here. So if I click on Browse and I attach something, maybe that's my first license, I can't click Browse and attach a second one. So you do have to, if you have more than one document, you have to combine them into one PDF before you can attach them here. So I'm just hitting Save. Now I didn't get the error because I've done all the required ones, but there's also attachment 5, the substance use disorder certification. Again, a document here that you need to print out, read, sign, and proof of prior relocation. If you're doing a relocation, there's also a document here for that as well. So let's say I have this one. I just am attaching a sample attachment, and I'll hit Save. Let's say I'm not relocating. Okay? All right, so if we go to Forms menu, I've done everything I need to. Let's pretend we don't notice that there's an error here. And the last thing is the grantee document folder. I don't think you're going to need it. I hope you don't, and we don't want you to kind of abuse this folder, but this allows for you to upload any other attachments that you might need. There's nothing else we're asking for, so don't worry about it. But if that ever arises, you give it a description, you find the document, and then you hit the Save button. I'm just not going to do that. All right, so that was, if you were wondering what that last form is, the grantee document folder, that's what it is. All right, so ignoring my one error, I feel like I've completed my application. How do I review it? Well, I would definitely go back to the pre-submission uploads, and I would click on View File to see all the attachments I've made to make sure that I filled out, that I provided the right document. You want to make sure you didn't scan it upside down or something, scan it backside up so it's a blank page or something like that. So I would definitely go to View File and make sure, yep, that's the attachment I meant to have for attachment 1, and so on for attachment 2, 3, and 4, and so on. So that's one way I would review before I submitted it. The other thing, you can go back to the Forms menu and program specific questions and see the answers you provided, or you can go to Print Application, And you can print it if you want, or you can just look at it on your screen, and you can see all of the answers you've provided for each question. You can double check things like the number that you provided and so on, and just make sure that everything looks good. So it scrolls through and shows all of the program-specific questions. It shows the details I put in for my budget information. It shows the narrative, which was the total and the year 1, 2, and 3 amounts. It shows my expenditure summary. And then the work plan overview form, which is, remember, the address and your profession. And of course, the dates that we filled out here. Objectives, task, performance measures, don't worry about it because that was part of the work plan that you didn't have to deal with. And then attachments, it tells you what was there, and it tells you that you've attached something, but it doesn't let you click on it. That's why I said, if I close this, that I would go right back to pre-submission uploads and double check those attachments. All right, so I feel like I've completed my application. I know I haven't, but let's pretend we didn't. And I'm ready to submit it. That's as simple as going to status changes and doing the apply status button for application submitted. Of course, I'm doing this prior to 4 p.m. on November 4th, and I click on apply status, and of course I get that error, wait a minute, you forgot to fill out question number 46. All right, let's do that. And I'll go here and skip down to 46. Oops. Okay, I put in my email address, I hit save. And now the error is gone, and now I can go to status changes and submit my application. So I'll click on apply status, and it asks me to agree to this agreement, basically saying I'm allowed to sign on behalf of my organization, which of course is you. I didn't give my password away to anybody, and I click on I agree. And always wait for it to be spinning. You see the spinning up here in the tab, and now it's refreshed, and my application has been submitted. Well, how do I know it's been submitted? A couple of ways. First of all, if we look at details, before we were in the status of application in process, now it's in the status of assignment of reviewers. I just got an email on cue, right? So if I look at this, congratulations, you've successfully submitted application number 001. And if I go back home, I don't have any more tasks. Remember I had a task down here before? Well, it's no longer a task for me because I've submitted my application. I can still go to applications and search for it. Remember, I could leave it blank since this is my only one. Hit search. There it is in that status of assignment of reviewers. So there's one last thing I want to point out, and it might take a minute to come up, but if I go back to my application, this is now after I've submitted it, and I go to the Forms menu, in a few minutes, application versions will be filled out, and there'll be a PDF here of my entire application that we just went through. So it only appears after you've submitted it, so that's why you do print application to review it ahead of time. But if we were to click here, there'd be a file link to a PDF with everything that we've just went through in a nice, easy, readable format. That's probably what the reviewers will be using to review your application. That'll include not only the questions and answers, your budget, the work plan, but also all the attachments we provided as well. So that'll all be in one nice document. So that'll take usually 5 or 10 minutes after you submit it to appear.
Thank you for joining us today for the Primary Care Service Corps WebEx. If you're interested in applying, please begin the Grants Gateway registration process as soon as possible, and we also recommend that you begin collecting the required application attachment information as soon as possible. Please email all questions to sch_loan@health.ny.gov. This concludes the presentation. File archive number 48558.22, New York State Department of Health. Thank you.